Give me that man that is not passion's slave, and I will wear him in my heart's core, I, in my heart of heart, as I do thee. I never understood Shakespeare, but we're talking about the heart, okay? So in chapter 11, we get into the heart and what it does. So when discussing the cardiovascular system, think of it as basically a pump, which is your heart, and then 60,000 miles of tubes that transport this medium, blood, throughout the body. Again, I think of blood as like a river of life, and this river transports all sorts of materials to the cells of the body. Cells do the work, right? Cells are alive, and blood transports the materials. So your blood vessels are the tubes through which the blood runs, and again, your heart is that oh so important pump that keeps it all moving. Now, where is the heart located? The heart is located in what's referred to as the mediastinum, sort of like the middle of your chest. So this is a cross section, sort of looking at the body from the top down. Here's your sternum. Here's a vertebra in the back. And then in sort of purple here, these are the lungs. Here are chambers of the heart. So there's your heart. It's in the center of your chest. Now it is sort of angled. Now typically we think of apex as being the top, but here in this case, the apex is at the bottom of your heart. And it's tilted toward your left hip. And then the base or the top of your heart is tilted toward your right shoulder. So your heart is sort of at an angle, pointing down toward your left hip and up toward your right shoulder. Okay, now the heart itself is surrounded by a sac called the pericardium. Peri meaning around, like perimeter, and cardi meaning heart. When you guys do your dissection for your pigs, you'll notice like a real tough fibrous sac around the outside of the heart. Now there are two layers to the pericardium. There is the fibrous layer, the outside layer. That's the more obvious layer. And again, it's basically got connective tissue that holds this sac in the center of the heart. And then beneath that is this serous layer. And it's sort of a slicker layer on the outside of the heart. And it will produce the serous fluid that produces friction as the heart beats within the sac. So again, when you do your dissection, the heart might not be super visible because of the fibrous pericardium around the outside of it. So once you cut out that sac, you'll be able to get at the heart itself. Of course, just like with anything else, you can have issues. So there can be pericarditis, itis meaning inflammation, in this case, inflammation of the pericardium. If you have decreased secretions of that serous fluid, then that can alter the heart's ability to contract and cause pain in the chest. Now, the heart itself has three layers that you'll need to know. The outer layer is the epicardium. Epi means upon. So the epicardium is super slick. When you guys do your dissection, those hearts are slippery. I've seen some people have their hearts slip out of their hands and fall on the table or on the ground. So again, the epicardium is a slick layer. So again, little friction between the heart and the pericardium. The middle layer is the myocardium. Myo means muscle. So the myocardium is that muscular layer where the cells contract and that actually does the pumping of the heart. And then the endocardium, endo means within or inside. The endocardium is incredibly smooth. Okay, so again, when you open things up, it is a very slick or smooth interior layer of the heart. In that way, you sort of make sure that blood flow is smooth. You don't get swirling in the blood, which can lead to clots. So again, smooth flow of blood through the heart. All right, now it's important to know the chambers of the heart. The upper chambers, it's a four-roomed pump. The two upper chambers are called the atria. And the atria basically receive blood. These are pretty small chambers, and they don't have very thick muscle. Like if you look at this illustration here, you can see how thin the muscular walls of the atria are. So the atria, the upper chambers, they basically receive blood from either the lungs or the rest of the body. And what they do is basically contract and pump blood down to these inferior chambers, inferior meaning below. And the inferior chambers are the much more heavily walled ventricles. Okay? So here you can see the ventricles, And again, these have much thicker muscular walls. The ventricles, they'll either pump blood out to the lungs or the rest of the body. So since they're pumping blood out of the heart, then they have much thicker walls. Between the chambers are these septa. Septa are walls between the chambers. There are interventricular septa. So here's the wall between the ventricles, or interatrial septa. So those are the walls between the atria. And one thing that you do want to pay close attention to, right and left side. When we talk about the right side of the heart, it's the right side of the other person's heart. It's the right side of the image. And then the left side will be opposite of your left side. So right and left are facing you. So always keep that in mind. Okay, what we're going to do next is discuss what's called the pulmonary circuit. Pulmo means lung. So in the pulmonary circuit, we're looking at how blood flows into your heart, out to your lungs, and back to your heart. So heart to lungs to heart. So we'll start in the atria. That's the collecting chambers, right? So the right atrium. So here we see the right atrium. The right atrium receives blood from two general areas, blood from above the heart and blood from below the heart. Now, one way I think of this as like rivers, right? Rivers have tributaries, smaller creeks or streams or rivers feed into larger and larger rivers. Well, that's sort of how it works throughout the body. You have these small little blood vessels called capillaries, and they feed into little veins called venules, and then they feed into even larger vessels called veins. And then the veins all feed into one large tube. It's either the superior vena cava or the inferior vena cava. Now, the superior vena cava collects blood from above the heart. So like from your limbs, from your head. So it drains your head and your upper extremities. So the superior vena cava collects that blood and dumps it into the right atrium. And then the inferior vena cava, inferior meaning below, it's basically collecting blood from below the heart. Okay. So all the little blood vessels collecting that oxygen poor blood from around the body either feed in through the superior vena cava or the inferior vena cava. And in both cases, they dump right into the right atrium. Now, when the right atrium contracts, it will pump blood down to the right ventricle. It basically uses a lot of gravity assist on this. So since the right atrium is above the right ventricle, when the atrium contracts, gravity helps push that blood down into the right ventricle. Now, the right ventricle, it will contract and pump blood out to the lungs through pulmonary veins. Now, we do need to talk about blood vessels just a little bit. Blood vessels are named named by the direction of the flow of blood. Arteries carry blood away from the heart. So just remember, arteries away. Arteries carry blood away from the heart. Ventricles return blood to the heart. So when the right ventricle contracts, it's going to pump blood out through pulmonary arteries. Remember, artery means you're carrying blood away from the heart. And pulmo means lung. So the pulmonary artery is going to carry blood from your right ventricle out to your lungs. And then in your lungs, you'll have these little capillaries where gas exchange happens. Okay. So again, this is oxygen poor blood coming from around the body. Cells have taken up oxygen and dropped off CO2. That gas then, the oxygen poor cells laden with CO2, travel to the right atrium, pumps blood down to the right ventricle. The right ventricle pumps blood out to your lungs. And in your lungs, you have another set of capillary beds. Here, you drop off the CO2 and you pick up oxygen. So now you have oxygen-rich blood. And then oxygen-rich blood is returned to the heart by pulmonary veins. Again, veins return blood to the heart. So here, it's a pulmonary vein going from the lungs, pulmo means lung, back to the left atrium. Okay. Let's see. Now, what we do here, again, this is right atrium, right ventricle, pulmonary artery, gas exchange in the lungs, pulmonary vein to the left atrium. Next, we pick up on the systemic circuit. The systemic circuit is basically pumping blood from the heart out to the body and back to the heart. So, beginning with the left atrium will contract and pump that oxygen-rich blood down to the left ventricle. Now, the left ventricle is the largest and strongest chamber of the heart. You see how thick the walls of the left ventricle are. When it contracts, it pumps blood out through the aorta. This is a big, thick artery. And then that will subdivide into arteries, arterioles, and then capillary beds all around the body. And then gas exchange will happen. You drop off oxygen to your cells, you pick up CO2, and then again, venules and then veins, and then the vena cava, both inferior and superior, will drop that blood back to the right atrium. So definitely know your pulmonary and systemic circuits, okay? Inferior, superior vena cava dump into the right atrium, pumps down to the right ventricle. Right ventricle has pulmonary arteries that go to the lungs for gas exchange. Pulmonary veins return blood to the left atrium, pump down the left ventricle, and then that oxygenated blood is pumped out through the aorta all around the body. Gas exchange happens again, then you have oxygen poor blood, and you just keep that going. Now, one interesting thing to consider, when the ventricles contract, how do you prevent blood from getting pushed back up into the atria? Or when the ventricles relax, how do you prevent blood from the lungs or like the aorta from seeping back into the ventricles? So how do you get blood from collecting in chambers that have just contracted and are now relaxing? Well, that's done through valves. So there are heart valves that ensure one-way flow of blood through the heart, or in this case, it's referred to as preventing backflow. So one important set of valves, they're called AV valves. AV stands for atrioventricular. Atrioventricular just means the valve between the atria and the ventricles. Don't worry about memorizing the tricuspid, bicuspid, any of that kind of stuff. The cusps are just like flaps, how many little flaps they have. Again, don't worry about that. So the idea is when the ventricles contract, pressure builds, and when the pressure builds, it snaps those valves shut. And when these AV valves snap shut, then blood does not go back into the atria. Now, the ventricles contract with enough force that you could actually flip the valves back up and push the blood into the atria. It's called eversion. So to prevent the valves from everting and pushing blood back up into the ventricle or atria, we have these little proteins called chordae tendineae. Chordae tendineae they're like if you've ever seen the guy wires on like towers, they prevent those flaps from going back up in the other direction and blood being pushed back up into the atria. So the chordae tendineae are these little strips of tissue here that prevent the valves from snapping back open. So the valves snap shut, snap shut, snap shut every time the ventricles contract. So again, when the ventricles contract, AV valves snap shut, and then blood doesn't go back up into the atria. Let's see. Now, when the ventricles are relaxed, okay, so here the ventricles are relaxed. When that happens, the pressure in the ventricles is low. These AV valves open up, and then blood from the atria can drain down into the ventricles. So again, there's a gravity assist there. When the atria contract and pump blood or push blood down to the ventricles, then the ventricles are going to contract. And again, when the ventricles contract, the pressure builds, these valves snap shut, and then that prevents blood from going back up into the atria. And again, when the AV valve snap shut, then the chordae tendineae are taut, and that prevents the valves from flipping back up. Another set of valves are called semilunar valves. Semilunar because they look like these little half moons. Okay? So when the ventricles contract, pressure builds and the AV valves snap shut. So blood doesn't get back up into the atria, right? But when the ventricles relax, okay, AV valves open up, but you could also have blood coming back in from the aorta or from the lungs. So the second set of valves, the semilunar valves, they snap shut when the ventricles relax. Okay, so when the ventricles contract, AV valves snap shut. When the ventricles relax, semilunar valves snap shut. All this works to ensure that blood flows in one direction, atria to ventricles out to the lungs and the body. You don't want blood collecting back in the heart. Now, we can have issues with valves, and the challenge is if these valves don't seal, if you have an incompetent valve, which just means it doesn't seal correctly, you can have blood leaking back into a previous chamber, and then you got to pump that blood again. Now, some things can happen over time. One is you can have a valve stenose. Stenosis of a valve just means it gets hardened and it doesn't open and close the way it should. So if we look at the image that we have here, you've got this healthy. Oops. Sorry, I'm not sure how things picked up here. But what happens is normally when the ventricles are relaxed, the valves are open, and when the ventricles contract, the valves shut. But with stenosis, you get this hardening of the valves. And so here you can see they don't open all the way, they don't close all the way. So what happens is you can get some like a whooshing or a whirring sound when in between heartbeats. Okay? So what you can do is basically replace them. You can use plastic valves, or you can get valves from animals that have similarly sized and shaped hearts like pigs. So people get valves replaced, and that can prevent that sort of issue. All right. Let's see. Let's look at circulation. This is cardiac circulation. So this is flow of blood through your heart. So you have this coronary sulcus. This is like a little groove in the heart. And in that are coronary arteries. Okay. Coronary arteries will branch out, and then that provides blood to the heart. It's important for the heart to maintain its circulation because it's the pump, right? If you don't have adequate blood flow through the heart, well, then the heart tissue begins to die. And if the heart tissue begins to die, well, then you don't pump blood through the body. Okay. Don't worry about the coronary veins, coronary sinus, right atrium, all that stuff. The big thing is just to recognize you have blood vessels that branch off and feed the heart, and you got to maintain those. Again, that's what happens with like a heart attack, right? People have these coronary arteries blocked, and then that blocks blood flow to the heart. Now, one thing that's interesting is that when the heart is contracting, the pressure builds, right? And that actually squeezes blood vessels closed. So as your heart rate goes up, you spend more and more time per minute with your heart contracted, and that's going to actually reduce blood flow. So everybody has sort of a maximum heart rate. And if you go above your max heart rate, your heart is actually contracted so much time per minute that you start to diminish the ability to deliver oxygen to the heart itself. Again, you can experience inadequate blood flow to the heart. So again, if your heart rate is too high, the vessels are squeezed closed too much of the time, and there's not enough time to deliver oxygenated blood to the heart. And you can also have an MI. It stands for myocardial infarction. An MI or myocardial infarction is what we typically just call a heart attack. Okay, so if you block blood flow to the heart tissue, again, the tissue dies, and then you don't pump anymore. So ideally, artery walls are smooth and allow for that smooth flow of blood through the heart. But you can have deposits of plaque, and then those plaques will reduce blood flow through the heart. Reduced blood flow or delivery of oxygen to tissues can cause angina, which is a form of chest pain. So when people talk about having heart attacks, the angina or the chest pain can be a result of not delivering enough oxygen to tissues. Okay, we'll save the other part for the second lecture. Hope this thing works.